Are you preparing for the NCLEX and keep getting confused about cataracts? So don't worry, today we will break it down in the simplest way possible, covering causes, risk factor, nursing care, and high-yield NCLEX questions you must know for the exam. So welcome back to ManpreetRN Talks, where we make NCLEX prep simple and effective. An older patient comes in the OPD with complaining of cloudy visions and hollows around the lights, but no pain. So, as a nurse, you immediately think of cataracts. So, let's go in depth into this complex, important topic. A cataract is the progressive, painless clouding of the lenses of the eye that lead to decreased vision. So it leads to opacity or clouding of the crystalline lenses that interference with the light transmission that lead to progressive painless vision loss. So cataract is a leading cause of blindness worldwide. So it is very important for NCLEX point of view. Next is pathophysiology. So in the normal lens physiology, the lens is avascular and that is transparent and composed of water and crystalline protein. So transparency is basically maintained by precise protein structure plus active potassium, sodium, ATPase pumps that regulation the hydration. So so it then our lens is clear, so light passes through the clear lens to focus on the retina. So in the cataract, there is a oxidative stress or aging that are the risk factor we will discuss in later. So that leads to lens proteins, crystallines, basically lens proteins called crystallines, they undergo denaturation means they are clumping. So the aggregation of the proteins in clumping that lead to cloudiness. So lens they become very where lens fiber where they lead to degenerate. This will lead to light scattering. So further hydration, it is also imbalanced that lead to further swelling and opacification of the lens. So that all ultimately lead to lens become very opaque, means blurry or hazy visions. So patho is not just as important for the NCLEX, but you should know about it. Light scattering in the eyes, inside the eyes that lead to clear and hollows and the blurred vision. So, and usually it affects bilateral vision, but it can be asymmetric. So, next is the risk factors. So, it is very important for sort of questions. So, first is aging. Aging related is the cataract is called senile cataracts. So, it is most common. Next is metabolic. It includes diabetic mellitus and hypocalcemia. Drugs, long-term use of corticosteroid that can lead to cataract, amidrone, and phenothiazines. So, otherwise, environmental risk factor include a long-term exposure of ultraviolet B radiation, smoking, alcohol. That is, as always, smoking and alcohol is always risk factor for any disease. Next is trauma, any injury to the eyes, surgery, or radiation that can lead to cataract. And the congenital, so it is maternal infections like rubella, cytomegalovirus, and genetics. Next is type of cataracts. So it is not as important, but you should know. First is nuclear cataract, that is central opacity is mainly affected. It is common with age. Next is cortical cataract, that is a spoke-like opacities, problem with glare. Third is posterior subcapsular cataract, back of the lens that lead to rapid progression linked with steroid or diabetes. Fourth is congenital cataract that is present at the birth. Next is clinical manifestation that is very, very important for NCLEX point. First is painless, gradual, bilateral vision loss. So you just remember it, painless, gradual, and bilateral vision loss. So that leads to cloudy, hazy, and blurry vision. Glare sensitivity means difficulty in driving at night. Patient are usually having hollows around the lights. Next is fading or yellowing of colors, diplopia in one eye. Red reflex is absent or white reflex is present, this thing we call leukoria. So what is red reflex is absent? The red reflection is the reddish orange glow seen in the pupil when a light ophthalmos bulb is shown into the eye. So it occurs because the light reflects off the retina's blood vessels. So normally bright red or orange glow is seen in both eyes. But in cataract, it is absent red reflex means something is blocking the light from reaching the retina. And the pupil may appear gray or white with advanced stages. So how can we diagnose the cataract? So we will use visual acuity test with the help of Selenium chart, slit lamp exam that shows the lens opacity, and the ophthalmoscopy, which can to reduce, we show reduced red reflexes.